Hello and a warm welcome to this, our third Scotland-Malawi Partnership SMMHE meeting on COVID-19. Thank you for joining this two-part discussion, which will focus for the next hour on supporting SMMHE members in Scotland. My name's Stuart and I'm on the staff of the SMMHE. I'll be facilitating this meeting, which will be recorded and available as with the previous ones on our website. A few brief housekeeping notes. Everybody is centrally muted at the moment. We'd request that you please remain so until speaking and keep videos turned off. This is only to support audibility and the stability of the connection. Please would everybody update how their name appears on Zoom to show name and organisation, and if you'd like any titles such as Dr, Professor, Ms, for example, Dr. Mary Smith, SMMHE. You can do this by clicking on the Participants button at the top of the Zoom window. Next, hover the mouse over your name in the participants list on the right-hand side of the Zoom window and click on Rename. Enter the name and organisation you'd like to be there in the Zoom meeting. Click OK. There is a limit on the characters, so you may need to use an acronym for your organisation. You can message everybody in the chat function or use the drop-down menu to select a participant to name them, to message them privately. The last COVID-19 Zoom call 2 weeks ago was deliberately open and free-flowing, but responding to feedback from members, this one will aim to be more structured with thematic segments, again led by what we've been hearing from you. So to achieve this, we'll need to be stricter with our time, so please don't be offended if I have to cut you off in order to move on. If anybody's sound is not audible, then we'll mute, and I would invite you to put any of the points or questions that you would like to in the chat function. Turning to the agenda, I'll pass in a moment to David Hope-Jones, our Chief Executive, to share a brief overview of the SMMHE's response to COVID-19, what services we're offering, what resources are available via our website, and to hear from you as to what else we should be doing. Next, there'll be a chance for anybody who'd like to introduce themselves to do so in just 15 seconds maximum, please. Realistically, just name and organisation. We're spread across a number of Zoom screens. We recognise that people will be joining at different times throughout the next 2 hours. If you'd like to introduce yourself, please click the raise your hand icon, and I'll try to invite everybody as much as possible in turn. Apologies in advance if we don't get round to everybody. Next on the agenda, we'll hear from Gemma Burnside, who leads on our youth and schools work. Again, this section will just last 5 minutes, so if you have a question or comment for Gemma, please keep it as brief as possible. From education, we'll turn to Faith Links, hear from David and SMMHE member Eve Hartswood. Then an update from MaSP's Chief Executive Officer, Mrs. Vera K, on MaSP's response and the services that they're offering to support members. Next, a segment on advocacy work and a focus on principles of engagement, which we've been hearing from you as members are important. 10 minutes then of open time for further questions and priorities to be raised by you. And at 2 o'clock UK time, 3 o'clock Malawi time, if we manage to keep the discipline to time, we'll aim to turn to Malawi to focus on listening to the situation there. David, over to you.
Fantastic. Thank you very much, Stuart, and thanks in anticipation to colleague Stuart for chairing this meeting. It's an unenviable task to be given such a detailed and precise agenda to try and get through. And I think we have up to 100 people or so joining this call at different times. Let me, as Stuart said, just say a very few brief words about what the Scotland-Malawi Partnership has done and is doing so far. We have, as I highlighted in the last call 2.5 weeks ago, publicly published our COVID-19 response strategy, and we have published the risk register and its implementation plan. We're keen to be as transparent as we possibly can with our members and with our funders and with the general public, in the hope that members continue to engage and feed into that plan, but also but also that, that members, if they wish to, are welcome to borrow from aspects of that risk register should they wish. There are 5 key areas since our last meeting where the partnership has been most active, each of which has been responding to our members' priorities, needs and concerns. They are youth links, support for postponed or cancelled visits, faith-based links working with our network, sister network, MaSP, and advocacy work. Each of those will have 5 minutes in the agenda upcoming, so I won't touch on in detail, but what I do wish to do is, if I can share screen. Sorry, Craig, it says you cannot start screen sharing while others participating is sharing theirs. Here we go. That seems to be now. Fantastic, thanks very much, Craig. Super, hopefully so if technology allows, you're looking at my screen now, which is the website, the Scotland-Malawi Partnership website. Just wanted to show you this to be able to highlight that we've got this new section, COVID-19, and really to encourage people to engage this as much as they can. The first section I'll highlight is this, how is the SMP responding here? And again, here you can find links to our strategy, to all the past meetings, upcoming meetings, what we're doing, the risk register, the priorities of continuity, support, innovation, and inspiration that are guiding all of our work. Next, and probably most importantly, is this page here, latest situation, resources and support in Malawi. Everyone on this call has an interest in the COVID-19 response in Malawi as seen through the lens of our bilateral relationship. And I suspect for everyone, it would be worth a few minutes of your time to look through this page. Let me draw out just a few quick highlights. There's information about the meetings such as this on the information sharing between SMP and MaSP. Here we have links to a plethora of different resources that are useful from the government of Malawi, from the UN, the official dashboard of the government of Malawi of tracking COVID-19 in Malawi, posters, leaflets, videos in Chichewa, Chitambuka, excellent videos, public health. We've got all sorts of advice on how to make PPE, where to source PPE. We've got a fantastic offer from Horizon Medical Education, who have developed a free CPD course for nurses in Malawi, responding to some of the challenges specifically there. We've got logistical support from Responsible Safari Company, information about repatriation of UK nationals, as well as regular news updates from Malawi. This page I won't go through in such the same level of detail, but gives the situation, resources and funding for organisations in Scotland. So probably of greatest interest are those funding opportunities that our members can tap into. We also are very active in raising awareness of appeals, both those appeals highlighted by our members or led by our members, which are responding to the COVID-19 crisis in Malawi. So for supporting, for example, healthcare institutions, but also those appeals for existing links that are affected by COVID-19 in Malawi. And we encourage members to help share those appeals and to donate generously. Finally, this page offers members' perspectives on the ground in Malawi. We've got a number of written and video submissions there, and really encourage everyone to think about what snapshot they can give of what their partners in Malawi are saying at the moment. It doesn't need to be exhaustive or authoritative. It is a snapshot of a specific place and a specific time, but encourage people to share, if they can, those perspectives. And we've got a number of videos and photos forthcoming there, but please do continue to share in that space. In the interest of time, I think I'll stop there, but again, to emphasize, youth, postponed visits, faith, MaSP and advocacy are probably our key areas of work, and colleagues will be talking more about that in a moment. Stuart, back to you.
David, thanks very much. So in terms of introductions, again, if people could say their name, their organisation, and if you can, and I'd emphasise if you can, within the total of 15 seconds, please make any offer or ask any specific question that you'd like just to be aired and shared with everybody. Just going down the list, Mike Beresford, please.
Mike Beresford, Zambezi Mission, 15 seconds up.
Thanks, Mike. Alan Laverock.
Alan Laverock, Banana Box Trust and SMP Finance Officer.
Amy Blake.
Oh, hi, Amy Blake, Chief Exec of Classrooms for Malawi, and there's an offer of support through our 28 partner schools and communities in Malawi to disseminate information if that's useful.
Thank you. Arafat. We'll come back to you. Jonathan.
Hi there, Jonathan Groves, the Crusoe Trust up in Aberdeen. We are working with a partner on distribution of soap and water, and so our water washing facilities. So we're interested in knowing all about making sure we can get hold of those supplies increasingly in Blantyre.
Super, thank you. Caroline, Kenyawi Kids.
Oh.
So we'll come back to you, Caroline. Cathy Ratcliff.
Cathy Ratcliff from EMMS International in Edinburgh. Our main work in Malawi has been for the last 5 years or so developing palliative care. We're now doing that in hard to reach areas of all 28 districts, which is obviously relevant to COVID. So we can offer that we can give information about palliative care development in Malawi.
Super. Chimsi Dori. Not hearing Chimsi. Chimsi is one of the directors of the Scotland-Malawi Partnership. Chisomo Samanji. Chrissy Hurst.
Hi there, I'm Chrissy Hurst from Cora Foundation, and I'm just really looking forward to hearing everyone's points about what's happening and how they're dealing with all these difficult new developments.
Thanks, Chrissy. Christine Campbell. Dr. Christine Campbell at the University of Edinburgh and is the lead on a Scottish Government funded project on cervical cancer screening together with Professor Heather Cuble. Daisy Belfield Santos.
I'm Daisy. I'm the Managing Director of Rare Charity, which funds tertiary and secondary educational scholarships on Thondwe Tea Estate, and we're very interested at the moment in developing remote learning support for our tertiary scholars in particular.
Thank you, Daisy. Just to make clear to everybody that you're centrally muted, so to speak you do need to first unmute yourself, please. Denis Robson.
Denis Robson, representing the Thondwe Community Partnership here in the Scottish Borders and also a director of the Scotland-Malawi Partnership.
Thanks, Denis. Dorcas.
Hi, I'm Dorcas from Water Witness based in Edinburgh.
Ellie and Douglas. Elaine Crummey. Emma Katengeza. Eve Hartswood.
Hello, I'm from a parish partnership and part of the Church of Scotland, and also a research associate. I'll be speaking later.
Thank you. Gemma.
Hello, I'm Gemma Burnside. I'm the Youth and Schools Manager for the Scotland-Malawi Partnership.
Gift.
Hello everyone, my name is Keith Thompson and I'm the Youth Heritage and Culture Intern for the Scotland-Malawi Partnership.
Thanks, Keith. Gwen Gordon.
Hi, I'm Gwen Gordon. I'm the lead nurse for the Scottish Emergency Medicine Malawi project. Thank you.
Thanks, Gwen. Heather Cuby.
Hello, Heather Cuby. I'm the chair of the Scotland-Malawi Partnership and work with Dr. Christine Campbell on the MALSCOT project for cervical cancer screening based in Coma. Thank you.
Thanks, Heather. Heather Palmer.
Hello, I'm CEO of African Vision Malawi, and we've been operating in the northwest Lilongwe district and Doha for 15 years. And we do projects in education, health, self-sufficiency, agriculture and water. Our concerns have been doing medical outreach, which was stopped, but that's just been lifted. And also about our scholarship students who now are all waiting at home pending exams. Thank you.
Thank you, Heather. Jeremy Bagg.
Jeremy Bagg, Glasgow Dental School, lead the MELDENT project. Thank you.
Lauren Opstad.
Hi everyone, I'm Lauren Opstad and I'm the Partnership Manager for Scotland and Northern Ireland at WellGrade UK.
Linda Dembo.
Hello. I'm Linda Dembo from Malawi Scotland Partnership. I'm the Programs Manager.
Thank you, Linda. You've got the most spectacular echo there. Liz Grant.
Hi, Liz Grant, University of Edinburgh, and I'm working in mental health and with faith communities and maternal health with partners in Malawi.
Thank you, Liz. Madeline Osborn.
Hello, I'm the convener of the Scotland-Malawi Mental Health Education Project, and we're looking at the moment of remote ways of teaching undergraduates and postgraduates in mental health, but also helping to coordinate mental health responses to the epidemic in Malawi.
Thank you. Max Conway.
Hello, I'm Max Conway. I'm a new member. I'm a politics student at Strathclyde and really just wanting to get involved and just find out what's going on. Yeah.
Welcome, Max. Great. You'll appreciate that we're doing this in alphabetical order, but excitingly, when people join, things get moved around a little bit. Master. Okay, Mercy.
Hello, I'm Mercy Maso, Country Director for WaterAid. WaterAid works on WASH in healthcare facilities and early childhood development centers. And during the COVID period, we have been responding, supporting WASH in healthcare facilities and urban centers. Thank you.
Thank you. Mick James.
I'm Mick James. I am the Treasurer for Fighting Poverty in Zambia, and we've got a set of relationships with a number of organisations in Malawi as well.
Thanks, Mick. And Moira Dunworth.
Hi, I'm convener of the Mimi Martin Fund. We support girls' education in North Malawi. I'm also director of Scotland-Malawi Partnership, and we have a room, an online room on whereby.com, which takes up to 12 people. If anybody would like to borrow that for meetings during this time, or indeed any other time, just get in touch. Thanks.
Thanks, Moira. Mr. MacDonald.
Hi, I'm Duncan MacDonald. I'm a trustee of the Chesney Trust that supports a high school for girls in Ekwendeni. I'm also a primary school teacher at the Mary Erskine Stuart's Melville Junior School that has the link with the Edinburgh Girls High School. I was due to go out to Malawi at the end of March to visit the school and to look for ways to grow a partnership with a primary school nearby, which obviously hasn't happened, so keen to keep things ticking over in the meantime.
Super. Nina Roots.
Hi, we run Love Support Unite in the UK and we work alongside Heather Palmer and Landarani Trust.
Thank you. Olivia Giles.
Hi, Olivia Giles, 500 Miles. We provide prosthetics and orthotics in Longwe and Mazuzu, but just on our skeleton service for now.
Pam Wilson.
Hi, my name is Wilson Mandala from the Malawi University of Science and Technology. I'm the Dean of the Medical Science School. I currently am the chairperson of the MaSP COVID-19 task force. So kind of like looking into what innovations different schools and departments are doing. So I'm kind of new. This is the first time I'm joining this, so I'm just kind of listening in to see what's going on. Thank you.
You're very welcome.
Thank you.
Paul Garside.
Paul Garside, Dean for Global Engagement at the University of Glasgow, and also a lead on the Blantyre Clinical Research Facility in Blantyre, Malawi with the College of Medicine, and helping them to coordinate and develop their response to COVID-19. And I should also mention that Wilson was also key in developing that laboratory.
Thank you, Paul. Brian and Gwenya.
Hi, Brian Gwenya, Edinburgh University. I'm currently coordinating the Kamuzu Academy Alumni Mask for Healthcare Workers Fund, which appears on the SMMHE website.
Rosie Bartholomew.
Hi, my name's Rosie Bartholomew. I'm a veterinary surgeon living and working in Bristol, but volunteering with the communications department at the SMMHE.
Thank you. Shupo. Shupo's in Equindeni and has joined us for the last two COVID-19 meetings very usefully. Stacey Lavery.
Hi everybody, I'm Stacey, I'm the fundraiser manager at the Liverpool School of Tropical Medicine. We've launched a COVID response fund to support our partners at the Malawi Liverpool Wellcome Trust Research Programme, and primarily for the clinician who's going to be working in Queens. Thank you.
Thank you. Sally Ray.
Hello, I'm one of the co-leaders of the school trip from George Watson's College, and similar to the teacher from Stuart Smileville and Mary Erskine's, just keen to see how we're getting along, and obviously with the situation for the trip in October.
Super, sorry. Sue Kevin.
Hi there, my name's have taken over the Raven Trust. We've been working with the Raven Trust for many years as a small group called Focus on Malawi. We've taken over the larger charity, focused down its activity down to supporting the development of sustainable eye clinics in the north of the country. We started with the mission hospitals, the 3 mission hospitals, but we're now starting to work cooperatively with some of the government hospitals as well. We're sponsoring students through college. We have 3 students at the moment who are obviously sent home because of the COVID-19, and we have 2 more due to start, all working within ophthalmology and optometry in the north of the country. Thank you.
Thank you. Susan Flynn.
Hello? Can you?
Yes, go ahead.
Susan Flynn, Chair of Shifundo UK. We have a sister charity, Chinaza Malawi, and we've launched an appeal, and I'll maybe say a word later about that, but we're particularly trying to respond to girls' period poverty at this time.
Super, thank you. Tamsin Lilly.
Yeah, I'm Tamsin. I run Medic to Medic, and we launched an appeal to support our graduate health workers to supply them with PPE kits. Yeah, so maybe I'll say a bit more about that later.
Thank you. Tanya Hendricks.
Hello, my name is Tanya Hendricks. I'm a PhD candidate at the Centre of African Studies, University of Edinburgh, and I research disaster governance and governance processes mainly in southern Malawi.
Thomas. Tim. Veronica.
Hi, I'm Veronica Evans, and like Sally Ray, I'm from George Watson's College in Edinburgh, and I'm on the Watsons-Malawi partnership.
Super. Very shortly, I'm going to hand over to Gemma Burnside to give us a Youth and Schools update. Very quickly, a couple more of the participants at the end, but no less for that on our list. And then anybody else who has joined since, if you could kindly write your name and organisation into the chat function so that everybody could see, please. Westgate. Yankom.
Hi everyone, Yanko Mataya here from WaterAid. Mercy has already given a brief about us, but I could add just that we're looking forward to scaling up our work in the healthcare facilities with a strong focus on hygiene, behavior change, communications, as well as infection prevention control. Also considering aspects of empowering citizens and, working with the government to strengthen their systems and prioritize WASH in the emergency response. Thank you.
Super, thanks very much. Apologies if that seemed like a very long school register, but hopefully useful for everybody to hear who's there. Gemma Burnside, over to you.
Hi, good afternoon, everyone. This is going to be a very short whistle-stop tour through kind of a youth and schools update for Scotland mainly, and Scottish schools that have links with Malawi. So in terms of the SMMHE and what we have on offer at the moment, we're currently working on an online youth network, which would be a platform for young people to join from Scotland who have links to Malawi, and a way of creating an online community of young people across Scotland who have a link. The main purpose of this is to keep promoting those links amongst young people between Scotland and Malawi, and also to provide somewhere to find out a little bit more about Malawi, to meet other people who have a similar interest, particularly looking at those young people who perhaps were planning to travel to Malawi in the near future. Secondly, our youth committee is just about to start recruiting, which is very exciting. Please do get in touch if you know a young person who might be suitable for this. This is anybody aged 14 to 24 who has an interest in the link between Scotland and Malawi. In terms of the kind of situation with schools here in Scotland, schools, it seems, and the teachers amongst us can correct me if I'm wrong here, it seems that schools are starting to kind of settle into the new normal, as we keep calling it, but it is challenging. Lots of teachers are currently looking for resources to help them offer education to young people at home. A lot of schools are carrying on with their partnerships with schools in Malawi, but this is really varied in terms of approach. For some teachers, this is a case of just carrying on WhatsApp conversations with their partner teachers in Malawi, and yeah, that work is very varied. We do have a large proportion of schools across Scotland who had visits planned to Malawi this summer that have had to obviously postpone those trips. Some of these have been postponed to October with the hope that international travel will then be available. But some are looking at postponing to next year or the year after. Schools are kind of working through ways of using the funds that they've already raised, as well as thinking about how those can be put into the postponed trips, and thinking about how money raised by young people who are not going to be able to join those trips because they'll be moving on from that school, kind of moving on to university or work or college, and will no longer be able to take part in the trip, how the money that they have fundraised can be used by the school. In terms of support for young people in general in Scotland, I would say that organisations like Young Scot have got some fantastic resources available to support young people through a really difficult and uncertain time for them just now. So I would really encourage those working with young people to use those resources. There are genuine concerns over kind of screen fatigue, which I'm sure we're all feeling at the moment, but particularly with young people, if they're being asked to learn through a screen, is that, you know, being asked to then use the screen for other interests as well is going to be quite taxing for them and quite difficult. So people are turning to looking at whether there are physical options that they can offer now. So ideas for physical activities and things like that. If you were looking at engaging young people, those kinds of physical activities are really, really welcome. There is a lot of good stuff out there that's on offer for teachers and people who work with young people at the moment in terms of training and options like that as well. The IDEAS Network, so that's the International Development Education Association of Scotland, has lots on offer. The British Council, through the Connecting Classrooms Through Global Learning programme, has a lot of CPD on offer just now. And coming back to the SMMHE quickly, we are looking at launching online courses for language and culture. So this would be looking at Chichewa and Chitumbuka in the first kind of iteration. So please get in touch if you'd be interested in taking part in those kinds of online courses. We are working with our usual group of tutors on bringing that to the SMMHE membership. And please do get in touch if you've got any other suggestions or offers for schools or young people as well. And that is a very, very quick run through, but I'm aware we've got a tight schedule today. Thank you.
Gemma, thanks very much. Do reach out to Gemma with any questions and comments or expressions of interest to become involved. Gemma at Scotland-Malawi-partnership.org or info@Scotland-Malawi-partnership.org. David, over to you on Faith Links.
Thanks, Stuart. Those who are last in this series of meeting on the 24th of April will remember that Eve Hartswood, who I'll turn to in a moment, made the excellent point that links between Scotland and Malawi have a unique role and a unique opportunity to be able to support both countries as they experience perhaps similar challenges through the COVID crisis. Keen to update, since that meeting, I've been working with Eve, and we've together written to the roughly 100 SMMHE member organisations and individuals that, as we see it, are involved some sort of faith-based link between Scotland and Malawi. That could be a church-to-church partnership, a sort of a presbytery to presbytery. It could be an NGO that is faith-based in its work, and I emphasise this is any and all faith and any and all denominations as well. I'll turn to Eve in a moment to talk through a bit about her research, why she proposed this, what she has planned, and the responses that we've had so far, just the last few days from that mail. But I wonder if I can also, just while it's with me, propose next steps in the space of faith links, and make sort of 4 or 5 bullet points here. The first is, as you're listening to this, if you're involved in a faith link with Malawi and you haven't been in contact with Eve and I, please do so. You can drop me an email, reply to the email that you got with instructions on how to join this Zoom, introducing yourself and your faith-based link, and we'll get you into that sort of community. Probably have a specific Zoom next week of those sort of dozen or so organisations that are active in this space and have responded so far. We'll look to be led by that group of what the most sustainable and helpful communication channel is, whether that's just periodic Zooms, an email group, or WhatsApp, or potentially a Slack group. We'll talk more about that later on. We'll likely also create an additional faith-based web page within that COVID-19 hub on our website that I showed you at the top of this meeting. And Eve is very kindly offering to write and collate a series of papers about how faith-based links between Scotland and Malawi are working together through the COVID-19 crisis. Those are some ideas of how we will take it forwards, but we will do so on a working group basis with those who contact the SMMHE to say that they want to be involved. Eve, over to you.
Hello, I'm hoping you can see my screen with a short synopsis of the work that we're doing. My thanks to the Scotland-Malawi Partnership, David and Stuart, for providing a forum to bring together the faith partnerships together. I'm Eve Hartswood. I'm part of a parish partnership with the Church of Scotland. I'm a research associate and SMMHE member. And the Church of Scotland has initiated research into how church partnerships support and understand each other during COVID-19. And this work is with the University of Edinburgh. All Church of Scotland partnerships are invited to contribute to this work. And the research proposals being developed with Denis, Robson, Carol Finlay of Church of Scotland, and Professor Liz Grant. I'm very pleased that the SNP is supportive of this research, and it has also opened up the opportunity to bring all the faith groups together to look at the issues around COVID-19. And this strand of study within the Scottish-Malawi Partnership helps support faith communities so that we can share our response to COVID-19, and opens up the possibility of discussion to listen and relate to each other's faith experiences. So the work within SMP might be more of an action study. So information can be quickly shared by SMP members as we're responding to the rapidly changing situation. And these ideas can be written up as sort of short open access articles, which can be made available on the Scottish-Malawi Partnership website, and it supports further research. So I would like to invite you to help build these connections and share ideas and information. There's an email at the bottom of the slide, Scot-Malawi Faith Partnerships @gmail.com. So we can start building our links with shared emails, and as David has said, there's opportunities for a Slack channel and a Zoom meeting later on. And together we hope to understand the needs of each faith community and the NGO groups to support and inform one another through this study. Thank you very much.
Thank you very much indeed. Over to Malawi and the Chief Executive of MaSP, the Malawi and Scotland Partnership, Mrs. Vera K.
Thank you, Stuart. I don't know if you can hear me. Can you hear me?
Yes, thank you.
Okay. I just wanted to give a brief update of what we have been up to at the moment. I think that the obvious reason was to redirect our approach to incorporate issues or to mainstream issues of COVID-19. We worked so hard the whole of 2019 to the beginning of this year to put together a new strategic plan that has now have to be put on hold, not necessarily put on hold, but most elements therein, we can't use them now because of the situation that we find ourselves in. So we needed to respond very quickly to do another strategy that takes us through for the next 3 to 6 months. And that's what we have been following, and it should be on our website at the moment. And obviously we've also tried to alter the terms of reference for staff members as well. But what we are doing on a daily basis also is to obtain information from the government of Malawi and the Malawi Health Equity Network, that is a network of all member organizations that are working in the health sector. They are providing very valuable information as to what is happening in the country at the moment. I should also hasten to add that the fact that because of what is happening now, I know maybe you may be aware of the judgment by the Supreme Court last week. What has happened after that judgment was that there's been a shift of focus from the COVID-19 to now the upcoming elections on the 2nd of July. So much so that now people are no longer observing issues of social distancing or gatherings of up to 100 and whatever. Now people are going in their thousands at funerals. We saw that funeral of the victims of arson in Lilongwe. There were thousands of people that attended that funeral. Now even political parties are now having political rallies. So I think there's been a huge shift, which is extremely unfortunate at the moment from both sides, opposition as well as the government side, now holding public rallies that are no longer observing social distancing, and that puts a lot of questions in terms of our prevention measures as well as the measures that government had put in place. And so that's just one aspect. And then on our members, what we are doing, we are providing practical and technical support to our members. Like last week we held a meeting because what we discovered was that most of our members, especially those resource poor local NGOs, didn't even know how they could hold Zoom meetings or meetings on Skype and or what have you. So we endeavored to provide a training session on how you can effectively use Zoom to hold your meetings both internally and even for those outside. We have also managed to keep our CRC. The board had told us to close our offices and all of us to work from home, but I think we were very keen to provide support to our members. So what we did, we are working in shifts to ensure that all our 3 offices are still open and accessible to our members that would need them, and we have seen an increase. But what is happening at the moment is that you have to book in advance if you want to come to our CRCs or to the secretariat, because we also have to ensure that we are regulating on the numbers that people can be at our office at a particular time. And just quickly, we are going to, in next week, we are going to hold a specific meeting to look at the ugly side, the good, the bad, and the ugly side of COVID-19, especially for local NGOs. The main focus of that training is going to be on financial survival tactics. And we have just managed to conclude the translation of our safeguarding policy to Chichewa and Tumbuka. We want to ensure that because we realize that in the fight against COVID-19, there will be a lot of safeguarding issues that are going to come in there. You're talking about human rights issues, gender issues, governance issues, and all that. So what we have done is to fast track our translation program to translate all the safeguarding policy to Chichewa and Tumbuka so that it should be made available to our members. And we have ensured that the youth have been well represented in that piece of work as well. So I think for now, that's what I can give as an update from our side. Thank you.
Thank you, Vera. MaSP held a very useful online event last week, expressing some of the deep concerns, particularly financial, amongst MaSP members, but also some inspiring innovations and adaptation from MaSP members too. We asked SMP members what the important principles of engagement around our response as the SMP to COVID-19 is. David, over to you on that.
Thanks very much, Stuart. Yeah, absolutely. There was, as Stuart says, a really clear ask from that MaSP meeting for the SMP with MaSP to have a clear voice on points of advocacy, particularly around the principles with which our members and our partners and funders are engaging COVID-19. Let me share my screen and show you some of the results of what we've got so far. So as far as sort of what we've done so far, we've been working with our core COVID-19 working group, which includes Heather Cuble, Paul Garside, Tony and Tracy. We asked them first, what do they think their principles are that should guide a good response to COVID-19? And then everyone that signed up to Zoom today had the opportunity on Eventbrite to feed in their principles, and a great many did. And also over the course of the last 2.5 weeks, a number of members have emailed us their principles and priorities. And I've quickly collated that now, not as a finished or final version, but very much as a starter for 10 for discussion in this meeting. I'll talk through over the next 3 minutes, 3-4 minutes or so, what we've got so far, and then throw it open for quick comments, input, concern, any reflections from members. But really, given the number of people on this call, most comments will need to come in by email. The next step with this is a meeting, Zoom meeting, that is co-hosted between ourselves, the Scotland-Malawi Partnership, and the Alliance for International Development. That's happening on Thursday, the 21st of May. Details will go up onto our website by the end of today of that meeting on Thursday, the 21st of May. That meeting is only open to members of the Scotland-Malawi Partnership and the Alliance, and will look specifically at points of advocacy around COVID response in Malawi, and how we as a community take those points of advocacy forwards. So what we're doing now is a starter for 10. I'll take some comments now over the next week, more comments by email, and that'll go forwards to the next meeting on the 21st of May, to which any SMP member and any member of the Alliance can join. The first point I would make, and hopefully my screen is being shared there, is that the existing 11 partnership principles that the SMP have that are on our website and that I've just done a screen grab there in front of us still very much hold true, and we're not looking to change at all. These continue to guide everything that we as a network do, and we hold ourselves accountable to these 11 principles. But what I've done is I've gone through the input that we've had from members and partners so far, and I've come up with 2 lists, each of about half a dozen points, which I'll very quickly run through now. The first are for what we're calling operational organisations. So we didn't want to limit this to just NGOs. We think it's as relevant for school partnerships and church partnerships and community links as it is for NGOs. Very quickly, these points do no harm. For example, not taking away key healthcare staff away from their work, not encouraging or expecting travel within Malawi that might risk spreading the virus. Just as we're advised in the UK, not to be buying up stocks of PPE where actually it's most needed in the clinical setting, and never giving advice that is in conflict with the advice that's being set in Malawi. Secondly, absolutely, as we always do, to support two-way sharing between Scotland and Malawi. This is a unique crisis because it's one that both Scotland and Malawi are exposed to at the same time, but respecting differences in resources, healthcare systems, culture, demography, geography, and climate between Scotland and Malawi, not assuming what works in one context will necessarily work in the other. Thirdly, understanding the local context in Malawi, really listening to and being led by Malawian partners, working with existing Malawian organisations and following government direction and leadership, recognising it's a dynamic landscape and that this will change, and remaining agile accordingly, not being afraid to change plans as the situation evolves, and helping to amplify that government messaging, particularly on social distancing and hand washing. Collaboration and coordination, as we always would expect to work. How do we use our networks to connect our members together, encouraging our members to share what they're doing and to collaborate with others? Fifth, continuity and commitment to existing work. Really important point from many of our members, which we want to amplify. Look first at what you can do to support the communities that you're already working with. It takes time to build trust and understanding locally. So work out what you can do from your existing relationships for additional funding rather than take resource away from what you're currently doing, and give as much clarity and reassurance to your partners as you can, while being honest where there is uncertainty. The final point, support the local economy through the crisis, recognizing Malawi will need to maintain a sustainable economy to get itself out of this crisis, just as we do in Scotland and the UK. So look to source locally, equipment locally, look to support the economy through appropriate employment, look to keep salary payments going wherever possible. So these are the first 6 points that we've got for operational organisations, so our members essentially in Scotland that have links with Malawi. Just briefly, for funders, there's 7 points here. Additional financial and practical support. How do we, given the scale of the challenge, we really encourage funders to be making extra funds available and resisting the temptation to claw money back from one area to be able to fund another area. We encourage open and respectful two-way dialogue with funded organisations who, with their local partners, have the best sense of what's going on. We encourage them to work through existing links and networks that are there, recognising again that those existing grantees have often the best insight of what's going on, to maintain normality as much as possible. If funders are already funding health or social education services, those should, wherever possible, continue. To maintain a flexible and understanding approach, supporting organisations to take the necessary decisions and supporting agility. To pause rather than cancel funding, work with key networks in decision making. Time is short in this call, in this meeting. I know I'll pass back to Stuart in a moment. Welcome any points now by email over the next week, and any SMP member that wants to join the 21st of May meeting with the Alliance to take those advocacy points forwards, please do get involved. And I hope that members feel that that's a useful product that we've been involved in. Back to you, Stuart.
Thank you, David. So again, the usual email address, david@scotland-malawipartnership.org, or one that several I see in the staff, info@scotland-malawipartnership.org, which will be displayed on the closing slide today. So over to you for questions. There's a wealth of comments and questions on the chat function as well, which if we don't get to during this meeting in this section, we'll certainly make sure feed into the social media chat Slack functions and follow up in the next session to shape that. Olivia Giles, you had a question. I don't know if you're in a position to ask that now.
I was wondering if anybody else had tried to balance the competing needs of needing to support the economy and support staff by paying salaries against the need to spend the charity's reserves in accordance with the charitable purpose, and feeling compelled not to just deplete the charity reserves by paying staff who are not able to deliver the charitable function. I'm just finding it difficult to feel that I'm on the right line.
Oops, sorry, beginner's error, hadn't unmuted myself. I think rather than hear a response to that, I'd suggest that anybody enters a reply in the chat function or emails us separately, and we'll share that going forward. Does anybody else have a question? Heather Palmer, African Vision Malawi, you had one on education. So there was one from Heather. Has there been any discussion about students taking their final exams in primary, secondary and university? We're all in limbo on our education projects due to COVID-19. Any other questions or comments at this stage? So I see Heather's added one in the chat function. I'm in Malawi at the moment, and as far as I am aware, all the cases of COVID-19 are urban-based. My concern is when it goes into the rural area, which is 83% of the Malawi population. Many have low immune systems and high levels of malaria, TB and dysentery. We're putting in hand wash buckets, chemical sprayers and sanitizer, and made 3,000 washable masks, distributing posters. The clinics will be overwhelmed. So this is a point that we'll be coming on to in the second session when we listen to Malawi, but it has been expressed very strongly that there is a huge gap, in the words of some of our Malawian participants, between awareness and behaviour in cities and in rural situations and villages. So certainly very much an issue of concern. If anybody doesn't have another question, I wonder if anyone has a response to Olivia's question. So again, that was, what are people doing about continuing to remunerate Malawian personnel when the personnel can't actually do the jobs due to COVID-19 and without just depleting resources? Chrissy has replied, possible option is framing looking at the problem. If you don't invest in those salaries, you risk losing the staff who'd be able to carry out the charitable purpose once it's possible for normal work to resume. In this way, those continued salary payments are risk reduction, future investment payments. Thank you for that, Chrissy. Who else would like to come in?
Can you hear me? It's Tim Eden from World Child Cancer.
Yes, Tim.
We have, I'm the founding medical trustee of World Child Cancer, and we've had a 10-year-long international partnership with Blantyre in Malawi. We've actually had government money, DFID money, and money from other sources. However, like all charities all over the world, and certainly in the UK, we're having it very difficult to find money to actually keep us going. So the charities have addressed this situation with regard to salaries. They are the most important people are the people who are working with the patients, and particularly the children in Blantyre. And so we obviously have to move the money from some future gains to actually that. And the same thing is that we have had good evidence and support from DFID and other charities to say we can divert the money from what we were given the money for in order to get PPE and other things that they need. So I think it's at the end of the time when everybody settles in Europe and so on, we're going to have to really reconsider what we can do in all the countries that we work in.
Thank you, Tim. Well, great to hear that sounds like there's some flexibility there of repurposing some of the funds, but funding is certainly a very acute concern for international NGOs based in Scotland, and we heard in MaSP's call last week, extremely worrying for a lot of organisations based in Malawi who are not able to implement their core services. We have just a couple of minutes left. Would anybody else like to come in with a comment or a question?
Stuart, it's Barry Clarkson in Dundee.
Hi, Barry.
Can I come in?
Please.
I'm sorry I missed the first half hour of that. I was on another call. Barry Clarkson, Emergency Medicine Malawi Project. I really welcomed what I picked up from David's last presentation. And as a member of SMMHE, could I just sort of voice on behalf of members in these unprecedented and difficult times that we're all facing. We're not going to feasibly travel to Malawi anytime soon, looking at the own restrictions we have in the UK, let alone the border controls that will remain in Malawi. Our projects are on hold. I mean, I think the flexibility and the agility David talked about from the funders is really essential. We need a pause on the normal flow of our projects without financial penalty. So I hope that SMMHE, Heather, David, Stuart, and the whole organisation will lobby that loud and clear for us with our funders.
Thanks, Barry. That's a very clear and useful message. Thank you for that. The need for flexibility and creativity, recognising that timelines are massively impacted. Time for one final point or question. Would anybody like to come in?
Hi. Can I make a comment, please?
Yes, please.
So Wilson Mandala from MaSP. So I just wanted to pick up the point that Vera made earlier on, and I think there was an additional point again later on. So there has been a change here since the announcement of the judgment by the High Court. I think it's the Supreme Court of Appeals. The point I want to make in a few minutes is that we have, I think, in my opinion, a disaster in the making at the moment, because people are just letting go of all the measures that were put in place and that have taken us this far with very few confirmed cases. I have a feeling that the numbers will pick up pretty faster than expected, than anticipated, because of what is happening. So I wanted to find out if it is possible to help establishment of additional testing centers within Malawi, especially to reach out to those in the rural areas, because again, this point has been made earlier on. Most of the cases that have been confirmed so far have come in from the urban areas. We cannot say there are no cases in the rural areas. It's just that they're not being tested and people are dying without actually confirming what they've died from. So my point is there a way of the Scottish government or SMMHE kind of like supporting establishment of additional testing centers within Malawi to reach out to those areas and also support the isolation part? Sorry, I took a bit longer than I expected, but that's my point.
It's very welcome, Wilson. Thank you for emphasising the scale of the challenge, the catastrophe that you foresee coming, and the need as you see it for much greater testing and for that to extend to rural areas. We'll certainly seek to come to that in the session that we're just going on to now. If you've just joined us, welcome to this third in the series of the Scotland-Malawi Partnership SMMHE's COVID-19 calls. My name's Stuart, I'm on the staff of the SMMHE. I'll be facilitating today's meeting. We'd ask that everybody please remains on mute unless speaking, just really for the stability of the line and to keep video cameras turned off. If we find that anybody's sound isn't audible, it sounds like they're 10,000 leagues under the sea, then my colleague Craig, who's hosting the technical side and is all powerful, will mute you, and that I'd ask that you then just please write in the chat function the question or the point that you'd like to make. If you have just joined us and you would like to introduce yourself in no more than 15 seconds, please, do please come on, unmute yourself and introduce yourself with name and organisation.
Hello there. Can I speak?
Yes, please go ahead.
Yeah, I've just joined. I'm Iwen Manonga. I'm a master's student at Lilongwe University of Agriculture and Natural Resources.
Thank you, Ewan. You're welcome.
Thank you. You're welcome.
Okay,
Hello.
is that Stuart? Oh, sorry.
Go ahead, Joel.
Okay, so my name's Joel, representing a project called Open O2. It's off-grid oxygen generation for rural places.
Super. Who's next?
Hello.
Shadrach, please.
Thank you so much. My name is Shadrach Nguruwe. I've just joined. I work for MaSP. I'm based in the Northern Region, specifically in Mzuzu. Thank you.
Thank you, Shad.
I think I can introduce also myself.
Please.
I'm Beatrice Kabota. I'm working with Nkoma Hospital in Lilongwe, representing Malawi Scotland Cervical Cancer Screening Project.
Great to have you with us, Beatrice.
Thank you.
Hi.
Hi, Willan.
Yeah, you have mentioned my name. I'm Willan Kalinda, working for Banana Box in Mzuzu.
Thank you. Great to hear you. Okay, anybody else? Otherwise, we'll move on. So again, just to emphasize that if you can skillfully divide your attention between listening to the presenters and keeping an eye on the chat function where there are questions and comments coming up. Again, after the meeting, we'll try to capture all of these and make sure that none of these valuable resources are lost to the process. We began last week advertising on our website and social media this call today, but unfortunately there was an error, for which apologies, that we didn't actually send a direct email to invite everybody. So some people are coming to this at a very short notice. We appreciate that people are extremely busy, and our first principle of engagement is, of course, do no harm, with busy frontline medical and other personnel extremely engaged in what they're doing, and certainly don't want to be pulling people away from that. So there'll be a slight change to today's program. It'll be a little bit more fluid than we had perhaps anticipated. But we're very grateful that one of our core organizing committee, Dr. Tracy Morse, who's been in Malawi for the last 20 or is it 25 years, Tracy is going to give us an update and overview of the situation in Malawi as she sees it. Tracy, over to you.
Thanks very much. Sorry, I find it really hard to speak with headphones on. Hi everyone, can you hear me okay?
Yes, thanks.
Hope you can. Yeah, awesome. Okay, great. So I'm just going to give a very brief overview, and some of you I know had already joined when Vera was giving an update as well previously, so I've already maybe heard some of this information. So I think, as you all know, Malawi's sitting at about 58 cases confirmed at the moment, 3 deaths, 24 recovered, and we still have the challenge of minimal testing centres in place. But it's very clear now that we have got local transmission going on, particularly evidenced by the recent spate of positive cases in health workers at Blantyre District Health Office, who were, I should say, asymptomatic, but the DHO was great there and wanted all of the health workers who had been in contact with cases to be tested. And so we can see that there's a lot of local transmission now beginning to expand. I think, as Vera touched upon, and also our colleague from MaSP a moment ago, particularly concerning now is that Malawi did start off really well with a lot of focus on preventive care, getting the message out, having hand washing in place, and you still see that around everywhere, and people clearly know what the messages are, but this shift towards having huge political rallies here in Blantyre last week as the papers were put in for the presidential election. I live on Old Chileka Road, and there were thousands of people walking up the road with the candidates and the subsequent rallies and things as well in the north and in the central regions are really of concern. And there's a lot of pressure also being put on the education department to open schools as well, which I was glad to see that the PS in the newspaper today was saying that they wanted to protect the health of the population, and attending political rallies was up to an individual, and going to school, they weren't going to force children to go to school and be in close contact. But these are all of significant concern, because I think people are perhaps becoming a little bit complacent, and looking north of Malawi, I think we have to start learning that Tanzania's cases are definitely escalating, the deaths are escalating, and it's potentially coming Malawi's way as well. The epidemiologists here in Blantyre are currently predicting that our spike will come in July. So although we put all of these things in place very early on, it's a long haul now, and trying to maintain those changes in behaviour are going to be incredibly hard. Looking at what maybe some of the partners that I'm directly involved with are doing, and I appreciate that there are many, many partnerships out there who are doing fantastic work. From the university's perspective, I know that all of the public universities have been working hand in hand with government to help expand testing, to look at innovations that are going to help. It was interesting to hear one of the introductions there for the off-site oxygen production. I know the guys at the Polytechnic, for example, are working on oxygen concentrators. So if you're not linked up already, that would be a great group to link up, and also other technologies that several of the universities are looking at in terms of PPE and hand washing as well. But we're also working hand in hand with government as much as possible to look at the implementation of the current COVID guidelines, whether they're the community guidelines or the health facility guidelines, and trying to look at where the gaps might be in those. My particular group is working on behaviour change, communication, and putting together very simple toolkits that community health workers can use, for example, to motivate behaviour change around the hygiene practices we need for COVID. And I think there's a lot of really great work going on, and a lot of it is testament to the partnerships they have with Scottish institutions as well. Really important that we maintain these meetings and we keep coordinating on what each other are doing. There was a lot of discussion at the last meeting about PPE. Just to give an update from what I know so far, as far as I'm aware, they're still planning on a big shipment of PPE coming in from China through MLW. They're still working on that, I was told this morning, but there's still the plan that that will be coming in. But that will only support main hospitals, district hospitals in the southern region, as far as I understand. Completely agree with some of the colleagues who've mentioned that there's concerns in the rural areas as the population starts to move around. I think a lot of the rural districts are trying to prepare as well as they can. There is a lack of PPE in those. They're trying to develop isolation centres, as they are in Blantyre as well, trying to expand the opportunities to isolate cases as well in other places. But I think if people are partnering with rural district hospitals or rural partners, it would be a really great way to help support preparedness for the potential onslaught of illness that might be coming. We still hope not, but I am afraid I think it will be with us very quickly. Soon as our colleague from MaSP said, the chances are that our cases will start to escalate. I think that's about all from me, Stuart, if that's helpful.
Tracy, that's really helpful. Thanks very much indeed. You covered a great deal of ground there, and I'm sure will fuel thoughts and questions that others have. We'll certainly connect up with, you mentioned oxygen, we'll certainly connect Joel with the Polytechnic there. As you said, a coordinated approach has been something that has been emphasised in the previous two meetings as absolutely essential, and we're certainly committed to doing anything we can to help coordinate and join people up as a civic society network. Turning to other members of our kind of core working group, I wonder whether Professor Paul Garside or Dr. Tony Ho, you'd like to come in with any points and updates yourselves.
Is Tony on the call?
Yeah, I'm here.
You go ahead, Tony.
All right. Okay. So since the last call, we have had a partnership project with the College of Medicine funded to look at occupational exposure to COVID in healthcare workers, which is timely because I think a number of DHO officers were tested positive over the last week or so, and we're just having conversations surrounding PPE and access to PPE for healthcare workers as well as research staff as well. So that study is just being set up. It's just been submitted to ComRec for ethics approval. And I'm in touch also with the teams at Malawi Liverpool Wellcome Trust, who are also doing the testing. So the two testing sites in terms of College of Medicine and MLW as well. I think they've had a few more cases that have tested positive this week, and they're doing contact tracing around those cases. I'm not sure if there's much to add other than that.
Thank you, Tony. Paul,
I can, so as Tony mentioned, there have been actually, I'll come back to you because Mapwatsa Mapando is just calling me, so I'll come back to you in a few minutes, okay?
Okay, Paul, thank you. Dr. Barry Klassen, I wonder if, sorry to put you on the spot, but I wonder whether you can comment at all on what you've heard from colleagues in Malawi regarding the level of support that they feel that they're now receiving in Malawi from the authorities in Malawi, because an expression of acute concern that we heard in a previous call was that the emergency medicine departments around Malawi felt really quite overwhelmed by what they were going to have to face with really very limited resources.
Thanks, Stuart, for putting me on the spot. Just to brief folks on the call, I project lead the Emergency Medicine Malawi project. Originally in 2010, we helped develop the Adult Emergency and Trauma Centre at Queen's, the first functioning coordinated emergency department. And our new project over these next few years is to develop further emergency and trauma centres at the major central hospitals in KCH and Lilongwe, Mzuzu and Zomba. While the huge concern they have, of course, is because of their acute and critically limited resource, that to deal with a pandemic of the scale that's hit Europe in the last few months would be a catastrophe in Malawi. And there is really concern. And we've offered, as you would anticipate, our support to our colleagues from a distance in the emergency departments. I think, as previous speakers have said, you know, the numbers are at the moment fairly low, but the potential is always you have to plan for the worst case to be able to deliver as things ramp up. I was very interested to hear from Tracy that the spikes predicted in July, which gives a few more long months of preparedness for the departments with isolation, but it is about getting the right equipment to them. You know, on an everyday basis, sometimes they run out of soap and water, which is going to make the simple public health measures you know, difficult to achieve. So, you know, any help that we can deliver, we're offering. But I think it's a great concern and a great worry to the clinicians in Malawi who have been asked to lead the response for these hospitals.
Thank you, Barry, very much indeed for that. I don't know whether your colleague Gwen Gordon would like to come in to amplify things from her perspective as well, since I'm in the putting people on the spot mood. Gwen, sorry.
And no, just the same as Barry, the concerns are early days. The nurses and clinicians that we're in touch with all the time, at the moment, they seem to have information from the World Health Organization, but we have offered the sort of all the COVID plans that we've used within NHS Scotland. So, but at the moment, I think it's just the PPE that's given them concern at the moment.
Okay, Gwen, thank you. We're going to turn to, yes.
I've just come off the call with Mapwatsa, so I can comment now. As you know, he couldn't make this call because he was chairing another meeting, but he wanted to make sure that an update was available from College of Medicine. So I would say, from our point of view, lots of places across Scotland are doing their best to help with coordinating the testing and supplying reagents, expertise, and protocols and so on to help with that testing. And I know, for example, other places, so Meru, based in Lilongwe, if you look on Twitter, have been doing training for testing within the last week. So Mapwatsa has just told me that Dr. Isaac should have joined the call, and he can give an update on the testing that's being coordinated through College of Medicine. And I think, as you've already emphasized, coordination is key with all of this. So hopefully, if I scroll through, there should be Dr. Isaac should have joined us, Mapwatsa tells me, or will be joining us.
I can see him on the call. Yes,
I'm here.
So Isaac Mokwatsa said you were going to give us an update.
Yes, he did ask me to provide some updates. So anytime you want to hear from me, I'm available.
Stuart, can Isaac go ahead?
Yes. Oh, okay, thank you.
Please do.
All right, thank you very much. The principal for College of Medicine asked me to give some updates in relation to what's actually happening at the moment. As the college, we, together with our partners, MLW and FLYNN, we continue testing, and we are also in the process of scaling up testing. We have established a number of testing centers in all the regions of the country. At the moment, we have 9 centers that are doing COVID-19 testing. So what we need at the moment is additional extraction kits and amplification kits. We are happy that the government has promised to continue supplying us with the testing kits, but because of the magnitude of the samples that we are receiving at the moment, we would love to have an automated extraction equipment. This will actually help to test a number of, to increase the number of samples that we test per day. So those are some of the points that I had to report in relation to diagnostics. We have tested over 1,400, to be precise, it's 1,481 tests at the moment. So this number is expected to increase because today we have also received a number of samples. So we should be able to release the results very soon. Some of the challenges that as a college that we are facing is the online teaching. So we have conducted a mean survey and we have noticed that 23% of our students do not have the resources to enable them to participate in an online teaching. So this still remains a challenge for the college, and we are still trying to look at ways on how best we can deliver learning to the students, and we need some support from that front. As a college as well, we have been on the forefront in trying to provide guidance and direction to the government through the TV and the radio programs. And we are also happy to mention that our chair for the College of Medicine COVID-19 response team, who is Dr. John Puka, has been included in the national or presidential COVID-19 committee. And we are happy that we will continue to provide our guidance and advice when need arises. We are still faced with challenges with the PPEs. Most recently, the Blantyre DHO conducted the test for health workers, and we are sad to report that some of our health workers have tested positive for COVID-19. We are still investigating whether this is due to whether they've been exposed whilst working or whether they've been exposed through their engagement with the public. We still don't understand at the moment, but we are trying all what we can to protect our healthy workers. Another concern is that what's going on with our political situation at the moment, we are still burdened with the fact that there are political campaigns going on at the moment. So these are kind of compromising our efforts to inform the public to adhere to the preventive and control measures. Because we have observed that local transmission or community transmission has occurred, and would love in as much as possible that the community has to be protected. These are some of the points that I was requested to report to the committee. Thank you.
Dr. Isaac, thanks very much indeed for that. Very encouraging to hear that you have representation on that presidential committee and feeding in at a national level. I wonder whether you happen to know the state of progress with the 2 ventilators that Dr. Gregory Gamula mentioned were going to be sent to the Ministry of Health just after our last call for certification and deployment.
No, I don't have updates in relation to ventilators at the moment, but maybe we might be given the updates in the subsequent meetings.
Thank you. Well, your update's much appreciated.
Can I jump in there? Sorry, it's Tracy, just on the ventilators.
Please.
I think there has been, I think they have gone, but I'm not sure there's been feedback, but I think there has been a move away from ventilators by Gregory and the team to look more at oxygen concentrators. And I know they're working with some of the team from Strathclyde to look at some sort of low-cost, easily manufactured oxygen concentrators. So I can maybe get more information on that from you, from Damien, and update you on that on email.
Great, Tracy. Thank you so much, and we'll share that update in the COVID-19 resources on our webpage and in future meetings. The political situation in Malawi has been mentioned, Tracy, but by you and touched upon by Vera, and obviously a major aspect of this. Vera, I wonder if we could turn to you. We're running slightly behind. I wonder if we could turn to you for maybe just a couple of sentences on the political situation and what impact that's having on COVID-19 response.
Thank you very much. I think the Dr. Mandala, MaSP from College of Medicine, has articulated what is happening at the moment in terms of the impact of politics on the fight against COVID-19. So, like I said previously, the Supreme Court judgment was given out last week, and ever since that, I think we are no longer, the nation is no longer paying attention to how many cases we have so far. For example, you know, like we would be very keen to listen to the Minister of Health addressing the nation. They would be, you know, we would know that tonight the Minister of Health is going to address us. There's a press conference and all that, but people are no longer doing that at the moment. Even if you could look at the discussions on social media, they're no longer on COVID-19. It's about the elections on 2nd of July. It's about the campaign that has started, because the MEC as well, they opened up their campaign. So I want to believe that the measures that we put in place by the Ministry of Health are being heavily undermined by the situation that we find ourselves in now. And also, just to mention the fact that there's a huge population of Malawians that are still not believing that we actually do have the COVID-19 among us. And that, I think last week I mentioned some of them to say, we have had a health system that is not working very well, especially for the poor. And also because of issues of politics and all that, then whatever the Minister of Health would say would be considered with a pinch of salt, even if he would be saying the truth. So politics is downplaying at the moment all the efforts that the government is implementing and putting in place at the moment. And for me, that's actually very unfortunate. The other thing is that while we still, there's a comment that someone was saying that all the cases are in the urban centers, and that's another thing that is also downplaying some of these social distancing and some of the measures that have to be taken into account. So apart from the washing of hands issues, people are no longer, they're not isolating, they're not observing social distance issues anymore. At the moment, including my church has opened up, we're going to church, and wow, we're keeping our 1 meter apart and all that, but after church you see people mingling and not really observing the social distance, whatever. It's like, it's an issue of last year, you know. So I think where we are at the moment, it's about the individual responsibility in terms of you protecting yourself and also your loved ones. But in terms of, as a nation, I think under the circumstances, I think we are highly compromised. That's what I would say.
Vera, thank you for that. Well, clearly a very significant development the politics, including COVID-19 and the clarity of messaging around that. And we've heard, as you say, from James Conway and Willen Kalinda, who's with us, and others, that there is a very stark difference in awareness of COVID-19, what it is, and how to respond to it, with hygiene and social distancing and so on, between cities, between urban areas and rural areas. And the points have been made that in the absence of information getting through, then people invent their own theories that COVID-19 is coming from smoke, or it's coming from flies, or it's only an urban disease for the rich and the elite who are able to travel to China, was mentioned as well. How is this messaging going to be tackled? We heard from Dr. Isaac there that there was involvement with journalists, and we've heard from Principal Mapando in previous calls that some of the journalism has left a great deal to be desired in the past. Vera, have you any thoughts on any further moves to centralise this this messaging?
Sorry, Stuart, you central messaging. Can you come again on your question? I think yes, I missed the first part of your question.
Not at all. So it had been raised by Dr. Isaac and previously by Professor Mapando that there's a need to engage journalists regionally and nationally to help communicate clear and consistent messaging around COVID-19. I just wondered if you were aware of any further developments in that direction.
Not at the moment, I am not. I'm in touch with the person that is in charge of sending out information in the Ministry of Information, and what they told me last week when I engaged them was that they are also getting their information from the Ministry of Health. But I haven't heard anything in terms of them being proactive in terms of sending out the messages. The key issue that was there from the previous weeks was the fact that we had a lot of sources of information that were at times conflicting, and also the government not really being proactive in providing the information, or contradicting each other at times. And then also the fact that they were not using experts or technicians that are savvy in these issues to be the ones that would be providing this information. So you leave out someone because maybe they are a PRO, and then they are supposed to be the ones that are providing the information. So I think for now we don't have anything yet in terms of engaging the journalists, but we have been lamenting for a specific communication strategy that has to be put in place by government that also incorporates the rural areas as well, because I think we may be privileged, us that are in the urban centers, that we have access to this information, access to internet and all that, but our friends in the villages don't have access to these issues, and therefore we can have the information, but if we don't have mechanisms in place to ensure that this information is going down to that level in those villages, then would have done nothing. So I haven't heard anything to that effect. Thank you.
Thank you, Vera. We've heard from James Conway and Willen and others the excellent work in local communities that Banana Box and Tafika and as Eve mentions in the chat function there, that church groups, faith groups are involved in helping share information. And Medic to Medic, thanks for that. Tamsin has posted that there's an address and a WhatsApp group there which people could be involved in. I think we should, looking at the time, we should turn to PPE now, which has been and continues to be a major topic in COVID-19.
Excuse, Stuart, can I come in before that?
Who's that? Yes.
Shadrach.
Shadrach, please.
Yeah, on the messaging and communications. Last week I was invited at Mzuzu City Council meeting. Like with the case with Mzuzu City Council, they have formulated a task force to work on this. So within the task force, there are subcommittees, and one of the subcommittee is the communications. and advocacy subcommittee. So they have framed the information that the communication and advocacy teams, which is comprised of different organizations, will be sending out, or the message that will be carried by these organizations. So they are using mobile vans to engage the communities. At the same time, some of the organizations offered themselves that they are going to send the messages or reach out to communities within their impact area in their respective area of work. So that's one of the issues that has happened with at Mzuzu City. But apart from that, there was an issue to do with prevention and of local transmission. So as of the case with Mzuzu City Council, we might experience a very high increase in the number of cases, because at the moment, one of the things which is happening is mostly testing. But in terms of prevention of local transmission, there is a very small thing or a little things that are being done. As of the day we had the meeting, the Mzuzu City Council said that they had a budget of about 100 million to work on this. But as of the day we had the meeting, they already had 3 million to work on that. So the gap is really high. Like in that case, the government of Malawi promised to give them about 35 million to work on that, but the government by that day had not released the money. So the fight in Mzuzu against coronavirus is very little, and we might have a very high increase at some point in time. Thank you.
Shadrach, thanks very much. Very useful comments there and update. I'd like to move on to PPE, but just to take account of Vera and others having mentioned before that one of the challenges has been the fragmentation of information and messaging and contradiction amongst apparent contradiction amongst government ministers. And Tanya in the chat function asks the question how communications are between the Ministry of Health and the Department of Disaster Management Affairs, DODMA, going. Again, because of the late notice of this event, we don't have anybody on the call, as far as I'm aware, from the government of Malawi to be able to respond to that. But we'll certainly, through our sister organisation in MaSP, if Vera thinks that appropriate, and take some soundings there. But good to hear of that task force, Shadrach. So on to personal protection equipment, PPE, has been raised as a major issue and concern. Dr. Isaac, I wonder whether you could focus on PPE for a moment for us.
Oh, thank you very much. Yes, the PPEs, initially, from the time we started testing, we've had challenges with the PPEs, but we recently received a number of supplies, so we have the necessary PPEs that we have, but they are not adequate enough. So we are still requesting that from the lab as well as from the surveillance team, the people that are going out, we also need to have enough protective equipment. In terms of numbers, I don't have the quantities at the moment to report, like how many eye visors or how many gloves or how many N95 masks we have. But all what I know is that from our meetings, we don't have adequate supplies. Thank you.
Thank you very much, Dr. Isaac. Just for anybody who wasn't on the last call as well, there was a point about the N95 masks being expected to be recycled, washed, and to last a week. And Dr. Mia Crampin in Malawi told us that there is CDC information which we've shared on our website as part of the resource there. Who else would like to come in on PPE?
Can I please come in, please?
Please do.
So Wilson Mandala once again from MaSP. So we have set up more or less like a design lab that has been looked at various potential innovations in response to COVID-19. And since we started, a couple of items have come out, and some of them include face masks, face shields. We've been working on a ventilator. Prototype is well developed, but it's not completely done yet. Also been working on disposable aprons that could be included as part of PPE. You know, being produced.
Wilson, unfortunately, we're struggling now to hear your...
In large quantities at the moment, the shields, the face masks, and the disposable. Sorry, I have to move around and try and get... Can you hear me now?
Yes, thanks. Please go ahead.
Right. So the three main items that we are potentially capable of producing in large quantities are the face shields, face masks, as well as the disposable aprons.
Thank you, Wilson. Just to check that, have you finished the point you wanted to make, or have we broken up?
I think I'll stop there.
I'll stop there.
Could I have a quick, could I just jump in really quickly? It's Stacey, sorry, I'll put my video on. I know there's quite a few people on the call who are obviously working with the College of Medicine and MLW, but LSTM are kind of procuring the equipment to come over from China as well, and as far as we know, it should be in Blantyre by the middle to the end of May, and we are sending over kind of 2 months allocation at a time for the next 6 months. That's what the plan is, potentially, and the COVID-19 response, Emergency Response and Resilience Fund, will primarily support PPE, oxygen, sanitisation facilities, all those kinds of things for MLW and Queen's, because MLW doesn't have a contract with the Ministry of Health, but they are a partner. So in the interim, I think what they're doing is they're sharing the PPE and the equipment with Queen's, and they'll do likewise as they receive their own kind of supplies. And the other thing worth mentioning as well is that MLW are doing quite a lot of surveillance in the community, and some of the health messaging that the science comms team and the researchers will be doing will be done through MLW too.
Could I come into about PPE, please?
Please, Heather, do.
I think that we have to remember that here we have not been very good at ensuring PPE gets to everyone who is at high enough risk. That's been particularly true in our rural areas and has resulted in the need for a lot of people to try and make their own. It may not be the same quality that you would have in the tertiary referral centres, the big centres and the big hospitals, but it does offer some protection. And we've had quite a lot of contact with our Malscott colleagues, and since Beatrice is on the call, it may be more appropriate for Beatrice to talk about the local provision, the local manufacture, which is necessary because the consignments that come in high quality, high numbers for the central institutions are not going to get to the rural communities who still need protection. And one of the other things that we have learned is actually we were not recognizing early enough the vast range of people who needed some protection. So Beatrice, would you like to add something about what you have been doing? I do have a slide of the sort of costs, if there are small groups that are interested, which came from Beatrice, can share that either now or later. But I do think we need to think across the whole country, because that spreads that Tracy and Wilson have spoken about so worryingly is actually what will really reflect the ultimate outcome of this epidemic, this pandemic.
Thank you, Heather. Beatrice, would you like to come in very briefly, please?
Yes, I think I can concur with Heather, as it is now in Malawi in most of the hospitals. Especially I'm talking to the areas where we are working to. Most of the facilities, they are in their need of PPEs. And especially when you are doing most of these, when you are being in contact with the patient, most of them, they are unable to be provided with these PPEs. So after discussing with all the focal persons from the hospitals, they did express that if we can have the locally made, at least they have something they can be protected from, because the way things are now, it's really pathetic that we have to work in such a way. So we tried to find out how much it can cost for us to do that. And I shared with Heather, I think she's going to, since she has it already, she will share the cost. But the problem now is how can we meet those costs? Because also it's something which most of those facilities, they have not budgeted for, and they don't have even fund for that to do. So I think that is the great thing which we are really looking for. How can we protect our workers in all hospitals? Yeah.
Thank you, Beatrice. Just to draw attention to Mandala's point in chat, reiterating that MaSP is now capable of producing PPE in reasonably large quantities. Heather, I think you're going to tell us about costs PPE.
I'm just going to try and share my screen with this slide if I can. Okay, so these came from Beatrice. And quite costly. I was surprised, I have to say, but it does give an idea. And it may be, for example, that some of the faith groups, the smaller NGOs, may be able to speak with Beatrice and get ideas of how they can ensure that there is local production to support what might be happening in MaSP as well and other places within the country. Can you see that screen?
Yes, thanks.
Okay, and that can go. That will be there on the recording here. So I'll let you get back, Stuart. That's all I wanted to say. Thank you.
Thank you for that, Heather. David, you appeared there.
Yes, I did. I suppose a question and potentially a contentious and sensitive one, not expecting authoritative detailed answers now, perhaps something for people to think about and email me. But I have been made aware that the UK government has bought relatively large stocks of PPE that does not meet the UK government's standards, and that is now in the UK, and probably the UK government would be quite grateful for suggestions of what could be done with that equipment. And probably would be quite receptive to the idea where it is generally safe, but for presumably a technical reason not meeting standards here. My question to the membership, and please email me your thoughts, is it appropriate for us to suggest where it is deemed safe to send that equipment to Malawi? Now, I'd like probably everyone on this call has inherent ethical reservations about that, but it is, complex and nuanced, and it might be that PPE could be used in areas of lesser need, non-clinical settings, to reduce the pressure on clinical quality PPE. So it's a question and a potential opportunity, but it's not something that we would probably look to take forwards unless we had a reasonable sense from members that they thought it was appropriate for us to do so. Welcome any responses now, but particularly by email over the next week. Back to you, Stuart.
Thank you, David. Any quick responses to that?
This is Daniel from UNICEF here. Not a direct response to that, but a bit of context about the UK government and their relationship with PPE in Malawi. They've recently released about over 300,000 towards PPE across districts in Malawi through UNICEF. But just to give some context to their existing relationship to that area.
Thank you, Daniel. That's helpful. So moving on now to a short section on appeals. So naturally, many of our members are and have launched appeals and we're carrying these on our website and promoting through social media. We're presenting them in two different categories. The first is a direct and specific response to COVID-19 itself, such as raising money for PPE. The second category is the no less important and entirely understandable need for organisations to raise funds to see them through the COVID-19 times and to be able to survive this. So these are all on the COVID-19 website that David highlighted at the beginning of our meeting today. So I wonder if I might turn to two of our members to hear very briefly from you about your appeals. Cathy Ratcliff and EMS first, please.
Hi, yeah, so EMS, we work with 5 partners all over Malawi, and actually with a rural health facility in each of the districts, each of the 28 districts. So our appeal is for PPE, which is going to be part imported and part manufactured by Mulanje Mission Hospital. We've also managed to repurpose about the same amount, about £10,000 of our DFID grant for PPE amongst our various partners who will take them to other Mentee facilities in rural areas. We're also just beginning to look at whether our appeal might stretch to some ICU equipment that one of our partners has just identified as being needed in the 2 central hospitals where they're based and where they do palliative care. But for the moment, we're doing, as I say, it's PPE, part manufactured, but part purchased by Mulanje Mission Hospital.
Super, Cathy, thank you for that, very concise, much appreciated. Turning to Mike Beresford, Mike at Zambezi Mission.
Hi there. I just wanted, we wouldn't describe it as an appeal as such. We're a faith-based organisation, so we more share what's going on in Malawi. And our particular concern, one of our partners has 5 different health centres in rural areas, and they're very materially challenged, I'd say. They're often short of equipment whenever we visit them. They're run through CHAM, the Christian Health Association of Malawi, and our sort of, what we've shared with our supporters is the need for us to help them with PPE. And we're sourcing that locally. We've got a field director based in Blantyre, and he's been sourcing that. We've had quite a good response from our supporters, but we're always open to, I think Cathy mentioned DFID, whether that's something that other people can apply to. We're always open to sourcing funds from other sources if possible. We have 2 other partners who we're concerned about. There's a Bible college that closed in March. They're financially okay at the moment, but there's this really big question, what next? Their financial projections for next year are looking particularly daunting. So that's a big concern for us at the moment.
Mike, thanks for that, and nice to see you, having exchanged so many emails before but not met. Yeah.
Troublemaker.
Stacey, I wonder if you're still with us. You mentioned earlier on briefly at the Liverpool School of Tropical Medicine. I wonder if you wanted to come back for another very brief point on your appeal.
Yeah, so we launched the appeal after our colleagues over at MLW kind of raised the issue around COVID and basically the impact, the devastating impact that it's going to have on the population. So the COVID-19 Emergency Response and Resilience Fund will support research here in the UK, but also our colleagues working on the front line at MLW in Queens, where there's around 200 clinicians working in the hospital, but there's also researchers and science comms teams working out in rural areas, carrying out surveillance and health messaging. And then, of course, we've heard that they're obviously working with the College of Medicine around laboratory support for testing as well, so they're playing a vital role in the diagnostics. So the fund, thank you so much, by the way, for putting it on the Scotland-Malawi partnership website, because we've received a couple of donations from that, which is fantastic news. And yeah, so basically all of the funds raised for that will support PPE for health workers, basic sanitation, support systems for oxygen, and obviously to treat adults and children. And what we are looking at as well is some kinds of you know, to kind of rewash PPE equipment as well. So we are looking into reusable PPE as well. So thank you very much for the platform to be able to share. And if there is anybody out there who kind of knows somebody that who might want to support it, then please do get in touch. And just sharing the link is really useful for us as well.
Thank you, Stacey. Thank you also for recognising that the platform's useful. We'll continue to share information and resources and continue to take account of the feedback that we do read in detail from these meetings and try to take account of. We've changed the shape of this one to make it more focused and less freeform, and trying to take account of people's time as well. So I hope that's been useful, but do please let us know how you would like to shape things going forward. David, I'd like to hand over to you for a summary.
Fantastic, thank you very much, Stuart. I'm very nervous about turning my webcam on because as I did at the very start of this meeting, the first thing that happened is I got a little bleep on the phone. It's a WhatsApp from Vera, my counterpart and friend in Malawi. She said, "David, your hair's massive." So I think a little bit of evidence that Malawi's perhaps a little bit behind Scotland in terms of lockdown and its cultural consequences. But in all seriousness, thank you very much to Stuart for again doing such a fantastic job in chairing this meeting. To cover as much ground as we have in the last 120 minutes is hugely impressive. And I very much count our lucky stars that as a small Scottish charity, we have such an experienced former BBC radio journalist on our payroll. So thank you, Stuart. Craig for managing the technology, and other colleagues. Thank you everyone for taking part. To have 75 senior representatives of different organisations involved in the Scotland-Malawi relationship is hugely impressive and inspiring as always, especially as you, due to a cock-up on our side, didn't get the message until relatively quite late on. I thought the networking was very good at the start of the first session. Thanks for indulging the time in that. And I hope there's lots of good bilateral links that have been made. Just a few that I took note of, introducing Joel to Tracy at the Polytechnic around the oxygen for hospitals, good connections with MaSP and PPE production, which we'll continue to disseminate. Just a few quick some highlights and next steps, if I may. We've had a number of requests of how can we keep communications going between the various stakeholders and members between these these meetings that happen every 2 or 3 weeks. My suggestion is that we create a Slack group. For those who don't know, that's an app that you can download on your phone, or for those who don't want their phone to bleep any more often than it already does, it's something that you can use entirely through your computer. We have a small staff team and we're very much operating at capacity at the moment. So I'm keen for a communications platform for this group to be taken forward to be very much member and user led. So you'll be able to opt into whichever groups are of interest to you and to manage your preferences as you wish. And that's a recognition that with GDPR, it's harder for a charity like us to be able to just willy-nilly share 100 email addresses as perhaps in other contexts we might have wished to. Our next meeting of this group will happen in 2 to 3 weeks. Next week, we'll send out a scheduler for those who want to be able to feed into when we have that group. And as we did for this one, everyone, as you book into the next meeting, will be asked, what agenda items do you want covered? And any other key questions to feed into discussions. The key working groups that we'll have going forwards, I propose we'll have specific spaces on the Slack group. They are youth and schools, led by my colleague Gemma, who'll be developing digital resources for young people in Scotland engaged in Malawi links but not currently able to travel, as well as a new series of online digital Chichewa and Chitambuka courses. The faith group will be working with Eve Hartswood, and my thanks to Eve for driving that forwards. We'll likely have a Zoom meeting next week specifically for faith-based links looking at COVID work. As Eve collects and collates a range of case studies in that space, we'll create a new web page in our COVID-19 web hub specifically to support and share between faith-based groups. And also for postponed visits, it's been agreed that we'll create a specific Facebook group, which has been deemed the most useful and appropriate channel to be able to support those members, school groups particularly, share information about how to manage the various challenges around insurance and whatnot. And our thanks to Dom at Orbis Expeditions for supporting that advocacy. I think generally there was support for those principles that we've began to collect from the feedback we've had from members. Thank you, Barry, for that endorsement in that space. Please do, over the next week, email me with any input or edits that you want to those points. We will email in the next 24 hours various follow-up documents to everyone that booked a place on this call, including those draft principles. So please do email me your edits. And if you're a member of the Scotland-Malawi Partnership or the Alliance, please do join the meeting on the 21st of May. Finally, in the second half of the meeting, it was excellent to be able to listen to those needs and priorities on the ground in Malawi. We recognize that the spike hasn't happened yet. It will come in July, and it may happen at the same time as the presidential elections and the challenges that that holds. PPE will continue to be a key priority for us, listening to our members our partners in Malawi, and congratulations to the good work that EMS, UNICEF and others are doing to support that. Testing kits, I very much heard what Isaac was saying about the need for more testing kits and more automated extraction equipment, and that's something that we can lobby governments and funders for. Tracy's point about oxygen concentrators, I think is a very good one, and I hope the connection with Joel is a helpful one in that regards. And again, this point around rural awareness, even rural disbelief of the situation and what's going on, is potentially an area we can support. The partnership represents the secretariat of both the Malawi cross-party group in the Scottish Parliament and the Malawi all-party parliamentary group in Westminster. And so I engage with MSPs, MPs and peers, all of whom have existing links with Malawi and are keen to represent the views of our members. So these are points that we will share with our partners and friends across each of the political partners, and they will look to influence government, both Scottish government and the UK government, on some of these points. I know many of you will have asked a question and perhaps not felt that you got the answer that you wanted from the group here, whether for lack of time or people just not being able to respond. Please be assured we go through every word that's said in these meetings, and we work sending emails and contacting people that we think can help in these areas. So I hope it's been useful. Once again, to have had 75 members all taking part was absolutely fantastic. A feedback form will be emailed very shortly through to you. Please do fill it in. Without a good number of feedback forms coming back, we simply wouldn't exist as an organisation, because we remain reliant on that fantastic funding from the Scottish Government to be able to do this, and that relies in turn on feedback from our members. So thanks once again to Stuart, and back to you, Stuart.
David, thanks very much for that masterful summary of key points and actions going forward. Again, this event, as with the previous ones, is recorded, available through a link on our website. We do really value your feedback and constructive criticism for future meetings. As David said, the next SMMHE COVID-19 joint meeting held with Scotland's International Development Alliance will be on Thursday, the 21st of May. More details to follow on our website and social media. Thanks to David, to Gemma Burnside, to Gemma Conley-Smith, to Craig Docking, and to the core members of our working group. And thank you for your time. We don't take it for granted. We appreciate everybody's very busy, and we hope that the meetings continue to be useful. For now, take care and goodbye.
Can I suggest